And that was so powerful for me. That was empowering. And I understood that, we have to speak up. We can't. Why are we scared to present ourselves as we are? We are strong women.
Welcome to the Pink Room, a space for real talk by real women about the real issues of our day. With your hosts, Shaunda Robertson St. Louis, Dr. Tricia Pinnacook, Theresa Alvarez Diaz, and Norca Blackman Richards. With moderators Kayla Cato and Chantal Fulgencio.
And going further, not only the color pitting, but also the female pitting. All right?
Oof.
The female pitting. We are in competition with other women, black and brown women. Listen, cut it out. Cut it out.
Exactly.
It doesn't serve us well. It doesn't.
It's the distraction. It's a distraction.
It's a distraction. Go ahead.
No one ever talked about something that just tore my heart apart because is this supposed to happen? Absolutely not. But I didn't have an outlet to talk about it. It scared me. It hurt me. Had no clue. And so what I'm experiencing today, based on all of these things, it almost put me right back into that same.
As a woman of color in the workplace, when you do not have a lot of people in your family who've been where you are, so you do not have people who can tell you this is the way to move forward. You don't know, you do not have the contacts, you do not have the family connection.
Start your watch parties. Cast the Pink Room on your HD TVs. Post your comments in the chat. This space is yours too.
Hello, everyone, and welcome to Pink Room number 5. Today, we're dealing with racism in healthcare. And we want to give honor to two beautiful women who we lost recently. One of them, Cynthia Gale in Costa Rica. Cynthia is the niece of one of our For Real Women International members, or regional director, Verna Clark for Latin America. Cynthia passed away today from COVID-19 complications. Cynthia was just 30 years old. And today we want to extend our condolences to her family. And we want to extend our sorrow also with everyone in her community, as she was a teacher. Today, we also want to honor the life of Shaunda Washington. Shaunda was a mother, a young mother to be, here from Brooklyn, state of New York, went to the doctor for a regular checkup, was a few days past due. When she got to the hospital, was informed that her pressure was a little high. They gave her some medication, then started talking to her about an epidural. Next thing you know, she died. Her baby is alive. So now we have a single father, young man, Juwan Williams, raising his daughter, Chloe, by herself. Shaunda Washington is again proof of why we need to get medical help and attention to Black women, why we need to take it more seriously in this country. So to Shaunda and her family, there's actually a GoFundMe page on her behalf. We invite you to join in and support this cause for Shaunda. But today I have with me my colleagues who are with us on the Pink Room. And we have so much to talk about today. It's going to be a very interesting time. But we want to share with you a very quick announcement. And it's, some of you might have remembered that we started our race today. we want to share a quick announcement of the race, and we want you to participate. It doesn't matter if you did not start today. Maybe you didn't even start this week. You can start next week. But we want you to know that this is something that we all want to do together, which is the International Women's Trek.
Hi there. I'm excited to invite you and your girlfriends to our For Real Women International virtual walk trek. Here's how it works. From July 26th to September 6th, you and your girlfriends will either walk, run, jog, treadmill, do aerobic exercise, and weekly report your steps. The teams with the highest number of steps win prizes. Teams from 2 to 10 can register for $50 towards our causes. Individual teams register for $20. You go to our website for Women International. That's www.rwi.org. Super excited. Hope you are too.
Thank you for that, Theresa. So let's start with the business of the day. And we have quite a few people who are joining us, and they're also doing watch parties, and we're so excited. Let's start with our heart check. Ladies, how's your heart today? What do you have to say? Who would be first? And what gives you hope, which is very important?
I was telling Shaunda, I was telling Shaunda before we started that this is, I couldn't figure out what to say in our heart check section because this has been such a week of so many things happening. I still haven't figured out what I'm feeling and how to process what's going on in the world, in our country, in Florida, in my house. What gave me hope was actually looking forward to this conversation because I know that at least there's at least some women who understand and who will be able to talk out loud about some of the things that we're concerned about. And that's what gives me hope, that we still have an opportunity to talk about these things and try to help ourselves and others to get through this time. But it's been a rough week.
Yeah.
Just to piggyback off of Tricia, I as well, I feel very numb. There's always so many things going on in the news and on social media, and it becomes very overbearing and overwhelming, and it's like it's too much to handle. And so I do feel very numb, and sometimes I take breaks from social media, just to give myself a clear mind and try to peace of mind. But what gives me hope is that there was this tweet on Twitter that came from Erica Williams, and I'll read it to you, and it says, "If 2020 has taught us all one thing, it's that a lot can happen in 6 months. Everything can change. So why not expect unimaginable good for the rest of the year? As we have seen, anything is possible." So that keeps me a lot of hope.
So true. The entire world changed in a couple of months.
Yep.
Yes.
Sure did. All right. I'll go. So my heart this week is, I was just thinking about, you all know, if not by now, that I love, our story and her story. And so I was thinking about what our ancestors had gone through in oppressive, struggling, being enslaved. How did they do it? And if we are talking about, we're not sure how to handle this virtual stuff, this COVID, the murders. Can you imagine? They had no technology again, and murders, lynching, rape, all of these things just, I don't know. But my heart is heavy with that thought. But what gave me hope? Self-care, which brings joy and liberation to me. So self-care really helped me this week.
And I want to chime in with Tricia. I guess if I could say one word that describes what happened in my mind this week, it definitely is like incredulous. I cannot believe. I'm shocked at the fact that you have people disappearing in Portland, being pushed into unmarked cars, and that this is the United States. This is not Russia, not South, not North Korea, not, this is the United States of America. And this is happening. And I was just, I just can't believe it. I can't. It's very difficult. I'm just trying to figure out like what is happening right in front of our eyes. However, in all of that, I do want to say that yesterday I felt just relieved that there's good in this world. One of my one of my sons just graduated from high school, and he and his classmates, inspired by one of their classmates, started a chat and saying, "Hey guys, there's this family who, my dad works with this guy, and they're really needy. They don't have any food. That there's a lot of need in this family. There's children." And anyway, those boys, and I don't know if there were any girls, but I just know that they're in a chat with my son, that these boys get together and they all decided to do something about it. And so this morning I took my 17-year-old to use his money to buy food for other people. And I was just like, that's, and I'm just feeling like this generation knows what it's about. It's about really, it doesn't matter what circumstances you're in, there's always somebody that you can do something for. And so I'm just really proud of, I'm going to say shout out to Alejandro Lopez Portillo, who's a former student of mine, who's the motivation behind all this. I'm just really happy that he rallied his friends, his fellow classmates to do something to help somebody. So that's how I am doing right now.
Everyone went.
Can you hear me?
Yes.
Can you hear me?
All right.
Okay.
Yeah. This week was a very difficult week for so many reasons, right? I think that I had to disavow myself of the notion that everybody gets it. And even if you don't get it, that during this time frame, you're going to do your best to at least toe the line and march in step with everyone else, because this is where everyone is going, right? So I had to disabuse myself of that idea. And it was hard because I found myself fighting some battles that I honestly thought that I should not be fighting now in this day and age. But here I am fighting these battles. It was very hard also to get the news about Shaisha. She is the cousin of the fiance of one of our Lead Academy graduates, Talia Williams. And I'd been following since Talia put this thing up maybe about a week or so ago. And it was just so heartbreaking that this young woman, you see her posing in those pictures, so excited to be a new mom, goes to the hospital for, what she thought would have been a regular thing with her boyfriend. And then he is left, this young man, to raise this beautiful little girl by himself. No answers to his question, right? And that was very sad. And then also hearing today about Verna's niece, also very sad, very, very sad. So it's kind of like, I feel like this week was kind of like a down. And the moms in Portland.
Yes.
The fact that they stood out there, some of them pregnant.
Yes.
Stood out there and got tear gassed.
But they stood out.
The veterans, the dads and the veterans came out.
Yes.
Saying,
yes.
You're going to shield the moms. It gave me hope, because even though there are those who refuse to see where we're marching, where we're going towards, even though there are those from the highest offices who would want to drag us back, because that's really is drag us, not even back, because I can't even say, drag us to something that we're not even, right?
Mm-hmm.
You still have the brave, courageous men and women saying, no matter what, you're going to
Enough.
send the message. This is not the world that we want for ourselves or for our children. So that,
Exactly.
honestly, despite everything, that gave me hope. That gave me hope. So today we're excited because we have Kayla Kata with us, one of our moderators. And she is actually going to be starting with a segment that we're calling the Pink Room Messages. And some of you have direct messaged us, emailed us, WhatsApped us. But Kayla's going to share with you a way in which you can contact us. And she's going to share some of the beautiful things that you have written to us and shared with us about last week's show and just in general about um, the whole idea of the pink room. So Kayla's gonna come on. Kayla, the time is yours.
Yes, so just to again piggyback off of what Norca just told us, the Pink Room, we do have an email address now. And so at this email address, you're more than welcome to let us know your comments, your questions, your concerns, or even if there's any topics that you would like to hear us speak about in the weeks to come. And so the email address for the Pink Room is Pink Room, which is PINKROOM at the number four, rwi.org. Again, so all together, the email for the Pink Room is pinkroom at 4rwi.org. So yes, please feel free to email us with anything that you have to say. And so we do have two messages from last week's Pink Room. And of course, I will leave the names anonymous. One of the first messages is some of my favorite takeaways from the Pink Room is adults do not behave this way. Their next favorite takeaway was we need a circle of sisters who will protect us from the wolves.
Mm.
Their third favorite takeaway was stand in front of our truths. And then their last takeaway is grace, moving the conversation forward. So we thank that person so much for their messages about our last week's episode. And the second person that we have here says, after listening, I now know that I must invest in therapy. I've been saying that I don't have the time to find one that works, but now I will. Thank you again and great show. So those are two messages. So those are two messages that we have. Again, please feel free to email us so that we can also relay your messages onto the Pink Room. And we want to thank those who have sent us messages.
Thank you, Kayla. So we move into in the news. In the news, what is going on in the news? Who wants to begin?
So this is Shaunda, and I will start. We want to keep the pressure on, and especially in reference to Breonna Taylor. It's still making news. Just this weekend, PBS reported that there's still no charges, no arrest, etc. It's basically trying to be swept under the rug. But in the meantime, another piece resurfaced in reference to which can relate to actually what we're talking about today. That after she was shot, her fiance reported that she was still breathing for about 5 minutes. However, medical attention was not provided to her until 25 minutes later. That's ridiculous. Wow. I'm just going to say it for what it is.
Yeah.
And also, the good thing about it is to hear the men who are out there supporting us. Tobias Harris, he is one of the 76ers, the NBA basketball player, Tobias Harris from the 76ers. During his press conference, he just said it would be nice to see that there would be some arrest for Breonna Taylor's murder. And
Yes.
the Tampa Bay Rays, when they opened up for Major League Baseball, said that it would be a great day to also have arrests. So to hear it coming from men who are supporting the death of Breonna, as we know, many women pushed the death of George Floyd. So it's really that brings hope if you think about it in terms of what we're experiencing in this world today. And then the other piece comes in with Judge Esther Salas or Salas. I may be pronouncing it wrong, so please pardon me. She lost her son, who was a really wonderful student. He was murdered by an anti feminist, Roy Dan Hollander, who cowardly committed suicide afterwards. He may be connected to the murder of another judge, but
Wow.
the interesting thing, and it was CNN who actually shared this information. CNN said that he'd gone before her. He argued a case before her. And interesting, the case that he argued was for a mother and a daughter who found that it was unconstitutional that women could not be drafted to serve in the military. Judge Salas, in kind, I guess, or just being the judge that she is, because she's had some high profile cases that she's handled, agreed with some of the things he said and disagreed and allowed the lawsuit to go forward. Hollander in 2019 removed himself from the case. It should also be noted that Judge Esther Salas was nominated. President Obama in 2011 nominated her, and she was also confirmed. So it's just interesting, even if you look at the political spin on that. Her husband was badly wounded during this break-in. Who this guy, and I guess we know it can happen, was in a FedEx uniform and was delivering a package. The son opened the door. The latest high-profile case had to do with one who we know, a pedophile for girls, Jeffrey Epstein. Just don't even like calling your names, but we need to put out there who they are because they've affected families, and so their names need to be noted. But she was going to be a part of a case that connected him because the Deutsche Bank investors were putting in a lawsuit because they didn't believe that their anti-fraud matters of laws was being dealt with properly. So this judge, high profile cases, search her. She's had some out there, and definitely seems like she was targeted. And you can connect it in so many ways to what's happening. So that's the latest. We need to keep the pressure on for protection for judges out there, especially when they're doing fair things, and for Breonna Taylor. Say her name.
Say her name.
Yes. Yes.
So
I'll go with Vanessa.
go ahead, Theresa.
Yeah, thank you. I'll go with, Vanessa's funeral services were just a few days ago, and most of what you will find in the news now regarding Vanessa, Special Officer Vanessa Guillen is more having to do with things that are not crucial to finding out, or to figuring out exactly what happened, with her murder, unfortunately. But the family has come out and they have talked about how they felt through this experience of having her funeral service. No governmental representatives came to be with the family, to speak to the family. No high profile names showed up, and it just, it really showed the family, that the fact that, there are things that are being just pushed aside in society. When you have somebody, a service woman being murdered in the way that Vanessa, was murdered, there should be, just a hue and cry, this is people who serve us. And unfortunately, they have not received the support, not from the, general community as you would expect somebody, a case like this to have the support. And so, they're calling out, a lot of the organizations and even high profile people who could have, stepped in and just said, we're here for you guys. A lot of what is in the news right now is just like, I can't believe it, but that's just the way things are. There's a lot of reporting about how, her family from Mexico was given humanitarian visas to come to her funeral. That's just a given. common decency will tell you that you at least allow family to be able to say, you know, their last goodbyes to their loved ones. And so I just, it's been one of those stories that is just very disappointing to see that they have not gotten the support that they could have gotten. You know, there's so many, you know, Latino artists, politicians, you know, a lot of people who could have just come in and, you know, shared a moment of their time to support the family. So I think that it's important to note that we need to be more conscious of. I mean, and anybody who has a platform can do something. Just, you know, showing up. I mean, look, when, you know, for George Floyd's funeral, I mean, people showed up, and I just think that there's a lot of people who could have showed up to this funeral that didn't do what was, you know, I think part of the responsibility is part of the Latino community. So that's what I have to update you guys on.
Agreed.
So this week, we heard the news of a mom in Florida who lost 2 of her children to COVID. Her son, 20 years old, and a couple days later, her daughter, 23 years old. And the reason I wanted to talk about this is because these were African-American mother and both children, young adults. And for some reason, some people still believe that this virus doesn't happen to them, right? There's still people that think that it just attacks older people or just, you know, people that live someplace else. And they're walking around still thinking that not protecting themselves is not a problem because they're not at high risk of getting the disease or of dying from the disease. And especially with the conversation we have today, it's so important for all of us to remember. It's so important for all of us to remember that our health is our own responsibility. Our health is our responsibility. Yes. And that we need to watch out for each other, that we do not know enough about this virus to believe that it's circumscribed to a certain group of people and it doesn't mean anything to us. I think that one of the things that I've learned from this virus is that it is a result of selfishness. A lot of what we're seeing in regards to how it's grown out of proportion is a result of selfishness. Individual selfishness, I won't wear a mask because I don't feel like it. And collective selfishness, right, in regards to who's going to gain from the first vaccine and the treatment and not sharing information between countries or between agencies or making politics more important than people. So that's selfishness. And the only way we're going to get out of this is through generosity. Individual generosity, when we say, even if I don't feel like it, I'm going to do it because it might protect you. And collective generosity, when we as a country, as a state, as a world, whatever community, whatever circle we're a part of, decide that it's important enough for us to do what we need to do to help others stay healthy. So if you're doing research on the vaccine or on prescriptions, medications, then thinking about how it can be shared, not how it can be hoarded. If you are thinking about how you go outside, what you can do to protect yourself and others, and not just what your rights are. Because if we continue down this route of it's not about me and, you know, then we'll never get out of this. And we need to do this together. And I think that the conversation we're having today is so timely, because it just brings together so many of the issues that we're dealing with. And that's why we thought it important to have it today.
Right. Yes. And I want to add, and I want to actually screen Denise Miller's comment here about it will only work as we push together. We have raised a selfish generation as a country. I want to add while we do not see it in the news as we saw it several months ago, the migrant children are still in this country.
Mm-hmm. Yes.
They're still in cages, some of them. They're still in homes and places that they don't know these people.
Mm-hmm.
They're still being sexually abused, right?
Mm-hmm.
Because they're these private contractors that no one is tracing.
This is just ridiculous.
Right?
Monica.
They're still being sexually abused. Let's call it what it is. They're still being dragged away from their parents. Their parents are still being deported, and the kids are left behind as a form of punishment. The latest news that we heard on this is that these children have been found in hotels, or they have been housed. Some of them have been housed in private hotels. And then suddenly now they have been let loose. Nobody understands where the children are, but the children are no longer in the hotel. Were they deported back to their countries? Were they sold?
Mercy.
Trafficked, right?
Yeah.
Right? So all of this, while we are fighting wars on so many battlefronts, we have children who came to this country with their parents seeking for a better life, because that's what it was. I'm very sorry if you think differently, but they're looking for a better life for themselves. That's what it is.
That's right.
And that
That's
is
right.
part of the great American dream. The Pilgrims did it. Right?
That's right.
No, don't act as if, oh my God, you know what? If they didn't
Everybody.
do it, not be here, right?
Everybody.
Only the natives
Everybody.
land belonged to, and only the Africans here. Everyone else came over, right?
That's right.
So these
That's right.
kids came over with their parents, and I'm sorry that I'm passionate, because I am realizing now it's triggering, because I actually got off of social media when these kids were when they first were jailed or incarcerated. I can't even find words.
Caged.
I could not believe some of the foolishness that people were saying out there, right? And I said, forget it. And I totally got off of social media. I shut down my Instagram. I didn't go on Facebook, because I was like, before let me just get off. And now to find that we're in all of this, and there's another layer of evil going on with children, innocent children. It is just unbelievable to me. There are no words. There's no way to justify this. Talking about the parents are guilty. Excuse me, your parents brought you too. You were younger. Right? We all in America, except for those two groups that I mentioned at the beginning, everybody in America came over, even President Trump.
Undocumented.
Right? Everyone was brought over. So to see that people are treated this way, because they don't have papers, and there must have been a better way. You did not have to degrade them. But again, that's the dehumanization, right? That is huge and central and core to racism. That's what that is.
Norca, I just want to emphasize something you said, because I think it's important that we see this. These are children as young as 1 year old.
Yeah.
Being taken unaccompanied by any person they know to hotels, spending nights. Nobody knows where they came from. Nobody knows where they go. And nobody knows who's waiting for them when they get to the hotel, or what happens to them while they're there. This is just, there's no argument that anyone can say that can justify this temporary taking them to hotel rooms. None. There's no explanation that can say this is why this is right. None. And there's no justification to say this is why this happened. So the only thing that can be left is there's evil.
There's a sinister reason for this new plan. There's a sinister reason for it. And as we all know, human trafficking is a huge business.
Yes.
Yeah.
Right?
Big money.
My fear is that these children are going to grow up.
Yeah.
They're not going to forget.
You can't forget that.
Right? These children are going to grow up. But let's breathe.
Yes,
this has been
that's
a heavy
hardcore.
week. This has been a heavy week.
It has been a heavy
It has been a heavy week.
It has been a heavy week. And I'm posting some of the comments here on the chat while we have these ladies who are joining us who are on the money with their comments. But it has been a heavy week. But today we are talking about racism in healthcare, and we have with us a special guest. But before we go to our special guest, we asked the doctor among us to kind of create a context as to this idea of racism in healthcare, right? What is it? How does it impact us? And Dr. Pennycook is going to share with us some things. I'm going to share screen here. She's going to she's going to break down for us some of this. And let me know.
Go right ahead.
If we're seeing the screen. Give me a minute. You can start, Tricia, while I
So very briefly, I think that it's important to set the stage to our conversation. And we keep hearing that African Americans and Latinx communities are more vulnerable to certain diseases, and we've heard it all our lives, and we'll keep hearing it. And many reasons are given why. And we'll talk along the time we're together today, we'll talk about some of those reasons. And more importantly, we'll talk about what you and I can do to level the playing field, so to speak. But before we get into that, I wanted to show some graphs that Norca is trying to put on the screen to show visually what it means to not expect to live as long and who is dying. So this first one is life expectancy at birth. And it goes from 1970 to 2017. So on the left, my left, where you see 1970 at the bottom, of the people who were born in 1970, white females were expected to live 75 years of age. And as time has gone on, their life expectancy has remained pretty stable and gone up. Black females below them, white males below the females, women usually live longer than men. If they don't, there's usually a problem. And way below that, you see the life expectancy at birth for Black males.
Wow.
So if they were born in 1970, Black males were expected to live 15 years less than their white female counterparts born in the same year in the United States. And they are the only, look at the way the line goes to the end from 2014 to 2017. See how it's starting to dip?
Yep.
So that's the first one. Norca, can we move to the other one? So these are death rates, 45 to 64 years old. And see how this is just not gender, just ethnicity, and it's flipped. So if we're looking at death rates, age-specific death rates, Black males have a higher death rate than Blacks in general, not males, non-Hispanic Blacks have a higher death rate than non-Hispanic whites. The lowest death rate is Hispanics. Next one, please. Oof. So this one we have by Hispanic origin. This is the same, kind of the same thing that we saw before. The next one, please. Again, you see non-Hispanic Blacks. I think we're going backwards, Norca.
Maybe.
Okay. Same kind of information we had before. The next one. And the following one. The following one. Okay. And now we're going to see, we're done with these four NORCA, now the one related to COVID.
Right.
So the graph that NORCA is going to show us now, we see deaths. This is the United States. We see deaths on one side. We see cases on the other. And this is only African Americans in regards to their share of the population. So anything that is yellow, orange, or red means that African Americans either have more deaths or more cases that they should have in proportion to their population. So look at how the cases look. Almost in every state of the country, African Americans are disproportionately affected by COVID. By deaths, it's not as significant yet. But remember that in some of these states that we see here, the surges haven't happened yet, right? So it's not necessarily that they have less deaths, it's that it's moving from cases to deaths, right? So in a couple to 3 weeks, what we see in cases is going to translate into deaths, because that's the way this pandemic is going. So we just wanted to show a little bit of what it looks like, not only because of COVID, but we see that from 1970 to today, we see the disproportion of what the amount of years that people can expect just in regards to their ethnicity and their gender.
Thank you, Tricia. We are so blessed today. We have with us Dr. Sharma, and Kayla will introduce Dr. Sharma for us.
Yes, so Dr. Sharma J. Charlemagne Badal. She has a PhD in social policy and social research. Her specialization is healthcare quality and impact on patient outcomes. She's a former assistant professor of public health, director of the Health Policy and Leadership Master of Public Health Program, and special advisor on health equity at Loma Linda University in Southern California. Former Maryland Public Health Chief of Quality Measurement and Reporting for Long-Term Care Providers and Commercial Health Plans, and is currently 2 weeks away from completing a Master of Science in Nursing at Johns Hopkins University. She has focused on considerable efforts on advocating for anti-racist curriculums in nursing education. So can we please all welcome Dr. Sharma Charlemagne Badal.
Hey, Dr. Sharma. So excited
Welcome.
to have you.
Hello.
Welcome.
It's nice to be here. Thanks for having me.
Thank you. So we have a couple of questions that we would like to ask you. And then after, when we do our main discussion, we just want you to be part of the discussion and share your ideas and your thoughts with us.
Absolutely.
Okay.
All right. So to start out, Dr. Sharma, this is Shaunda. Just want to ask you one. As a social policy expert, could you name 2 policies that are guided by systemic racism?
Well, Shaunda, thank you for asking, and to the entire team of ladies here, thank you so much for having me. It's a pleasure to be here today. And there are so many policies that we could talk about, really, that are grounded in racism. Just as a blanket statement, this country was really built on racism. Okay, and so it is no surprise that we can find racism weaved into every aspect of the society. Okay, and healthcare is actually no exception. And so I just want to start by framing this a little bit and talking about why we see racism in healthcare. What are really the origins of racism in healthcare? What was the purpose of it? And in a seminal article written by Krieger in 1987, she talked about the scientific basis for racism and talked about how racism was integrated into medicine strategically. And it was really used to reinforce negative stereotypes about Blacks in particular. And this was really important because the founders of this United States that we're in really wanted to highlight what they said were biological differences between Blacks and whites specifically, to essentially convince themselves and the world that Blacks were inferior to whites. And so then it would allay their guilt and allow the perpetuation of slavery, and then later institute policies that would ensure a lower socioeconomic status for Blacks in this country. So this is the backdrop against which we are talking about racism in healthcare at the moment. Okay. And this work was published in 1987, and several prominent researchers continue to cite this work. And in fact, the racism embedded in medicine is basically perpetuated because it's taught in schools, okay? And then you also have providers and healthcare workers in the healthcare system actively providing care to Black patients or patients of color, and essentially kind of keeping that cycle going, all right? Wow. So I know, Shaunda, you asked me about two specific policies in healthcare policies that are, have at their foundation, racism. And I want to talk about two in particular, okay? I want to talk about the absence of, I'm going to start with talking about the absence of policy. Okay, that's what I want to start with. I could go directly to policy, but I want to talk about the absence of policy. And one is a healthcare system in this country that leaves out a substantial number of citizens of, when I say citizens, I'm not talking about, a passport or a nationality. I'm talking about people who live in this country, leave out a substantial portion of people in this country who need healthcare, who need access to healthcare because of the nature of its structure. And what do I mean by that? I mean that health insurance is not universally accessible in this country. Most people gain access to health insurance through employment. However, you have policies that ensure that Blacks receive the worst education in this country, and so have limited access to jobs in which they can get access to health insurance. So the absence of a universal healthcare policy in and of itself sets us up to be in a situation where we have Black and brown and other racial minority groups in this country who cannot get access to healthcare because they do not work in jobs that provide these kinds of benefits. And that is a major issue that we're facing in this country, continue to face. And every administration has been advocating for or against it. And in 2010, the Patient Protection and Affordable Health Care Act, otherwise known as the ACA, was developed and rolled out in order to address the absence of a universal healthcare policy. The absence of that policy is truly based on racist ideology. It has to do with the idea that only some people are valuable enough, only some lives are valuable enough to deserve access to healthcare. That healthcare is not a basic right. Okay, so that's the first thing I'll talk about. And with this current administration, you see the ongoing efforts to undermine, to dismantle the ACA. Okay, and you hear the use of language, being used, calling it Obamacare. And that language is strategic because as long as you're able to attach a former president's name to the policy, then you create a dichotomy, you create division because then now you have people for or against based on party affiliation, even people who stand to benefit from the implementation of the policy now are supporting the dismantling or even weakening of the policy. And you see the three main pillars of the policy being attacked all the time in terms of the guarantee issue, the subsidies that the government would provide, and then the individual mandate to actually have the policy. Okay, so that's the first thing I want to talk about. Now, the second policy that I want to talk about, the second sort of social policies that I want to talk about, I mentioned before, I kind of touched on it, and I'll go back to it, and you probably guessed it, education. As long as you can ensure that one group of people in this country have access to good education,
right,
another group does not have access to adequate education, right, you basically guarantee that the group that has less access to good education, okay, then remain the sickest people in our system. And that directly has to do with, one, access to healthcare, like I discussed before, access to health insurance, but also just literacy and an understanding of what the healthcare system looks like and how to access it, how to get into it, how to, if when you do interact with it, how to advocate for yourself, how to be compliant with post-discharge instructions, for example. And so you have the conflation of several policies, or the absence of policies, that basically create and sustain the perfect storm in this country, which is disparities in health status, in terms of the number of people who are sick, who is really sick, who's carrying the larger burden of disease, and who's dying more from these diseases, who's living longer versus who's living shorter life. And not just how long you live, but what's the quality of your life, really. Okay, so you have other policies such as, lending policies. I'm talking about like financial lending policies that also disproportionately disadvantage minority groups. You have the predatory lending that was responsible for the last, great recession that we had in the between 2007 to 2009, thereabout. And so you have many factors coming together, but all of them, if you notice, always disproportionately disadvantage minority persons of color. Does that answer your question, Shaunda?
Did it? It definitely did. Thank you so much, Dr. Sharma. I really appreciate how you actually started out with just a major clarification that this country was just founded on racism. So thank you for starting out your answer with that in relation to policies, because then we better understand why these policies are racist in and of themselves. And some people don't realize it, they're not conscious of it, but thank you for clarifying that for our live audience. At least now they're educated to understand this. But it also reminded me, if I may say, before I go to my second question about us, when you shared the part about sometimes people, the professionals in the healthcare system, continue to follow the same pattern. It's just like the field that I'm in, which is a social worker. It says being a gatekeeper. So thank you for sharing that, because now as I realize that at some point in my career, I see that there's some gatekeeping in me, and the changes I have to do and advocate for policies is the same in a crucial part, which is our healthcare system.
Yes, absolutely.
And so my second question to you, Dr. Sharma, is, and I like also how you said the lack of policy too. But here goes. Are there specific policies in relation to healthcare that Black and brown people should be calling our local politicians about right now, saying these policies needed to change yesterday?
Yes, absolutely. Because, we have a system, one, that was not set up in our favor. It wasn't set up to preserve our health. Or to ensure that we live good quality lives or long lives. But we are trying to function within that system. We are trying to thrive within that system, not just exist, right? And so what some of the recent conversations in the healthcare field has been around the issue of provider bias in healthcare, specifically. And California actually is leading the way on policy in regards to addressing bias in healthcare. And as a matter of fact, a new policies rolled out in February 2020 of this year that requires healthcare providers or healthcare workers to receive bias training. Okay. And you may ask yourself, well, aren't they receiving that? Isn't that kind of a given? Because let's face it, we all have our blind spots, right? There are populations that we know little about. Some of us know little about different populations and so on. And you would expect that in the process of training a healthcare worker, that they would also be trained to recognize their bias and to address their bias so it does not come in the way of the care that they provide. But that is not necessarily the case. So I would say we need to be asking our politicians, not at this point, not even asking, I would dare say demanding from our politicians that one, the data is available on how we as Blacks and Black and brown people are negatively disproportionately affected by racism in healthcare. Okay. And two, and related to that, we also need to be demanding training for healthcare professionals as they enter the field and as they remain in the field, to continue to be trained in ways that would allow them to provide equitable, unbiased care. And that may sound like such a simple thing, right? But it isn't. It isn't so simple. It isn't as simple as it sounds. And in fact, in terms of bias is such a complicated concept. Okay. Now tell me if I'm going into something else you want to talk about, but I'm just gonna segue there because just to create the perfect context for what we're talking about. Why should we bang on the doors of politicians to deal with this issue? Bias is complicated. And if you've noticed, the language around bias in healthcare tends to be very mild and palatable. So the fact that we're even talking using language like implicit bias and microaggressions, as opposed to just saying it's racism, we're not comfortable saying that. How many years have we spent talking about the social determinants of health? We thought we were so woke when we're talking about the social determinants of health, talking about, we're going upstream by addressing the social determinants of health. You know what nobody wanted to talk about? The fact that these social determinants of health, the reason why they are as problematic as they are is because of what?
Racism.
Nobody wants to talk about the elephant in the room. Everybody wants to talk about it in the nicest possible words, the most palatable words. And you have to think about, well, who came up with this terminology? Who came up with these terms? And how did we come to accept them? You know, what if we called them what they were? Would it change our approach to them? And the other question is, by continuing to use that language, does it absolve institutions and providers from responsibility for their actions?
Wow.
That's what you need to ask yourself, because if everything is a default to implicit bias, because you hear that word being thrown around quite a bit now.
Right.
If it's default implicit bias,
that's right.
Where is the responsibility? So in what world can you just say, I didn't mean it in a bad way, and you're immediately off the hook? Tell me where I can get that kind of grace. But apparently in the healthcare system, a lot of actions or inaction, we're talking about Shaunda today, right? You mentioned Shaunda and so many other, Shaunda Washington and her untimely death.
Yeah.
So many Black women and brown women have experienced the same thing.
You have.
Can we hold healthcare? And me too.
You have. I have.
Yes, you too.
So it's not just in textbooks.
Yes, it's happening.
And it's not only related to education.
Nope.
Right. Right.
And maybe Sherma, would you please spell a little bit out what social determinants of health are?
Oh, yes.
For
Sorry,
those of us who may not understand the
everybody
term.
is on the same page. But basically,
Dr.
we talk
Sharma,
about.
Dr. Sharma, I'm
Yes.
sorry, and Tricia, I'm Facebook. You heard it live. Dr. Sharma said it. It's demanding, not asking our politicians.
Yes.
So thank you before you go into this.
That's
And
right.
we know this is an election year, a lot of elections. It is demanding. It's no more asking, begging,
That's
and
right.
pleading. We're no longer step and fetch it. It's get out there and demand it.
And may I add this? May I add this? As you know, somebody said that we need patient training. Like they need to to train us when we go and request medical care. I think that is one of the most powerful things that we can do is we need to not only demand to our politicians, but we need to demand to the people who provide health care to us.
That's right.
We do not go in there like, just whatever you say. No,
Absolutely.
they're there to service us.
Teach advocacy.
Anyway.
Yes,
okay.
Absolutely.
I just wanted to say that.
You know what, Theresa, I have that on my list. So thank you for bringing it. We're going to get to that. But yes, let me go back and just explain what the social determinants of health are. So the social determinants of health are factors beyond an individual, beyond a person that affect their health. And we talk about where you live, the physical environment. We talk about your access to healthy foods. We talk about your access to education and a bunch of other social factors that affect your health. Right, the quality of your life that you can have. Okay, so you will find in the scientific literature you hear a lot of language about health disparities, and the connection to social determinants of health is, well, people don't eat good fruit and vegetables, they don't have access to healthcare, they don't have good education, good jobs, and so on, and that is linked to their health status. So that's why I said going further back and talking about using the 5 whys approaches, right? That was developed for the Toyota company, asking why 5 times to get to the root of, as a way of analyzing, performing a root cause analysis, right? You ask why 5 times. So going further back then takes you to the root of the problem, as opposed to staying in the space that you are. So if it's unhealthy, if it's disproportionate access to unhealthy foods and beverages, asking the question, well, why does this group of people have more access to unhealthy foods and beverages?
That's right.
Right? And then say, when maybe the answer is, well, there's more advertising of unhealthy foods and beverages. Well, why is there more advertising of unhealthy foods and beverages in certain communities compared to other communities?
Right.
And you go far back enough, and you know where it's going to take you.
Right. Right. As opposed to saying, Dr. Sharma, which many say, oh, that's the diet, they love sugar. No. Go back further.
This is Coca-Cola.
This is strategic.
What Coca-Cola does in Latin America.
Oh my goodness! Don't even start.
Yes, exactly. What Coca-Cola does in Latin America is criminal.
It's criminal.
Criminal. They should be sued, and they should be paying for people to get healthy again, and because it's their fault. I am totally.
I like what you said, Theresa, because while public health professionals and tons of dollars are going into public health initiatives, you have at the same time these big companies undermining the work that's being done.
Absolutely.
Exactly.
Right.
Okay. So, you have all the public health workers here and everybody else, all these professionals that come together to try to improve a community. And then you have a billboard everywhere for unhealthy foods and beverages. And you also have no supermarkets, so they even have healthier options. You just create a situation where you don't have good transportation. You create a situation where it's very hard to make a healthy choice.
Right.
And then, of course, you're going to hear the statistics. Blacks and brown people have higher rates of hypertension, diabetes, it runs in the family, and those flippant kind of phrases put out, when really and truly that is not the heart of the problem.
Right.
And it can paint the picture that there's something wrong with us because we have more of everything, and that's actually not true at all.
Yeah,
true at all. We are burdened because it was designed that way. It was
Exactly.
designed that way. And so when we ask what can we do, not only do we want new policies moving forward, we want the dismantling of the old. And we want restitution for the damage that has been done.
Yes, ma'am.
The damage.
Absolutely. Absolutely. Theresa, I think you had a question, or
yes,
tell me your question.
Yes, and I think that I'll go ahead and make it at this point, because I think that we've been segueing into this, and I think this is, to me, in my mind, I think this is where we really can actually take control of what's happening to us, because really, in the general sense, we might feel that we have nothing that we can do, that we don't control policy, that we don't control what our healthcare providers how they see us or how they treat us. But that's the question. What is in our hands to do that will help eliminate these misconceptions regarding Black and Latino women when it comes to healthcare? What can we begin to do to make a change?
I think that's a huge question, right? We could literally talk about this all night, and then we still wouldn't have even scratched the surface of it. But here are some of the things we can do. And you mentioned it a while ago, Theresa. We need to educate our people.
Right.
Yes.
We need to make information accessible to people in the simplest terms. Put aside the complicated statistics or anything. Just give it to people in the simplest terms. What exactly am I looking at here? And what can I do to protect myself? Okay, that's the first thing. That's on the individual level. Then you want to look at the family level. You want to talk about the fact that you have the same racial groups coming to this country in the same ways, but having very different health experiences. And so you want to highlight that there's nothing genetically wrong with you. Okay, there's nothing genetically wrong with you. We're going to have to now, as a family, stop saying this runs in my family.
Exactly. Yes.
Because it does create a feeling of helplessness.
Yes.
For family members, and just feel like, well, I'm just waiting for my turn.
Yes.
Or need to get diabetes or something else. We need to actually really. There are some things that are genetic. Okay, there are some things that are genetic, but I'm talking about lifestyle-dependent diseases, things like diabetes mellitus and hypertension, largely that can be managed or reversed with lifestyle changes. And there is scientific proof that it is possible. There's scientific proof that it is possible. But one other thing I want to bring into this conversation, which is so key. It is so key. Hear me. You guys ready?
Yeah.
Yes. And I'm ready.
I want to talk about stress.
Yes, ma'am.
Wow.
Yes, ma'am.
We're listening. Go. We're listening.
I want to talk about stress. Arlene Geronimus, who is a public health researcher at the University of Michigan, she is in the Population Studies Center. She talked about the weathering of the Black body.
Yes. Oh my goodness.
Oh my.
Weathering of the Black body. That when you see a pregnant woman go into the hospital to give birth, it's about a woman who is 10 years older than her chronological age. Her body is 10 years older or more than her chronological age because of stress. Now think about it. When was the last time you were able to wake up out of your bed, leave the house, function throughout your day, and not remember that you were a woman from another country, had an accent, or was Black or Latina? When was the last time?
Never.
Ever.
And remember, these things are not pluses for us in this society.
No.
They put us at risk continuously, all day, every day.
It's a constant fight and a constant battle.
Yes, as a Black or brown woman, you can't speak your mind like me. I'm pretty feisty.
Really? No way.
I can't speak my mind, and so many other women like us, without us being labeled as loud,
Yeah.
emotional,
Yeah.
Yes.
as
I think that's
mad.
what other people think, and that's
Angry,
where the
mad.
problem lies.
Angry.
Yes.
The B.
Yep.
Mm-hmm.
The B.
Yes, exactly. I remember one time I posted on Facebook, I said, just think about it. You know, we're walking out the door. We have to remember to fix our hair in a certain way that it wouldn't offend anybody. The hair that grew out of our head, the hair that we were born with. We have to talk soft enough not to offend anybody. We have to mind our facial expression not to offend anybody. We have to not walk too close to people so they don't think we're trying to snatch their purse, even though our purse is probably heavier than theirs.
Yeah.
We have to go into work, and we have to work according to what our parents told us 10 times harder.
Yeah.
Okay. Then when we go into a store, we have to deal with the injury of people pulling away from us as if there's something wrong with us.
Right.
Or following us in the store.
Insult upon insult, psychological insult upon insult.
And sit in spaces as the only Black face in those spaces, and
absolutely
literally going their arm because you know it's going to be a fight.
Yes.
Well, would it be fair to say these are terrorists?
Then you will be mad, angry, aggressive, threatening, all of that.
Right.
These are like terroristic attacks on us.
Mercy.
Exactly.
It is. Woo! And Dr. David Williams out of Harvard School of Public Health talks about, actually he created a scale called everyday racism. I prefer the terminology that he uses because it's straightforward. He just calls it what it is. Racism we experience every day. Basically, it's little slights that you experience every day because of your race and how it impacts you and it wears on you. I prefer that as opposed to something like implicit bias. That's just me. Implicit bias kind of sounds a little too mild for me. Yeah. I just want racism to be attached to your behavior. That's what I want.
Yes.
Agreed.
Okay.
Agreed.
And so he's actually a Black man, world renowned for his research on racism and health. He's actually from the country of St. Lucia, my island. And he created that everyday racism scale. But it's the small things that happen every day. And you would think when you go to a clothing rack and you try to push some clothes aside just to look at what's happening, and people size you up and down and then walk away. He actually is able to measure all of these psychological insults against you as an individual.
Wow.
Okay. And this is just the tip of the iceberg. When you go into a healthcare setting, people don't believe that you're in as much pain as you say you're in, because once again, the racist medicine they've been told them that you can bear more pain.
Right.
Now that was so the slave masters can get away with
right.
And working you to the bone.
You're right.
And still be Christian. That's really why that existed.
She said it.
To deal with guilt. Okay. So your skin was thicker. You didn't feel as much pain. And even now, your pain will be minimized.
Yeah. Even now.
Your pain will be minimized. And as a matter of fact, there is a term called epistemic injustice. And there's two aspects of that: hermeneutical injustice and testimonial injustice. And I'll talk about the testimonial injustice. And it has to do with the minimizing of your testimony about your own experience.
Woo!
Wow.
Okay.
Oh no.
So when you go into a healthcare setting and you give your testimony about your pain, somebody else wants to tell you that you're not experiencing what you said you're experiencing.
Yes.
Ladies,
Dr. Sharma, you should be in charge of the government.
We are bringing school to you today.
Yeah, absolutely.
We are bringing school to you today.
Absolutely.
Yes.
Okay.
Dr. Sharma,
yes.
You know, I'm listening to you. My question was going to be, but you already answered my question. My question was going to be if you believe that racism in healthcare had to do with the practitioners, the providers, the training, the healthcare policies. Actually, you've already answered the question. It's a little bit of everything with a foundation of
But I have more to say about that, Norca.
Right. Yeah. Give me some more. Give me some more.
So, Sherma, just before you start, if you can mix into that your experience as a nursing student.
That's where I'm going, honey.
Okay, good.
Are you ready? Are you buckled up?
Wait, let me add something right before you go into your experience. You answered the question, and I know you have more to it, but could you also address the internalized racism of those practitioners and providers that are Black and brown and believe the lies? Because that has happened to me. And you hear nurses talking about, oh, she's okay, don't give her. And I'm like, I'm dying here. She's okay. You can hold it, baby. You can say, what are you talking about? So we have internalized the lies, right?
Norca, remind me not to forget to answer that, because I have something to say about that.
Okay, good. Thank you.
Okay, so racism in healthcare, where does it all come from? Well, education is not just about a degree. It's not just about a piece of paper. It's about a socialization.
Yes.
So when you come out of school, you not only have a degree, you can express yourself a certain way, both in written language and verbally, okay? So it's a socialization. You get to understand how the world works, or you're supposed to, okay? Right. You're supposed to be able to understand how the world works and what different factors in the world that affect you and affect the persons that you provide care to. But what if you are educated in a system that does not reflect your reality or the reality of people of color? Mm-hmm. What if the textbooks, and I saw a comment posted on here from one of our viewers that actually specifically mentioned the textbooks, and I just want to shout out that person. I don't remember the name, but I saw it flashed across the screen.
Dr. Saida Bar.
Here's the comment.
Yes, absolutely. And so this is what happened.
Sorry, just hold there. Everyone, you need to be doing watch parties. Like this woman is spitting fire and gold. So you need to
diamond
everybody
jewels
into the room right now, putting this thing all over your social media, because it cannot get better than this. So
it's recorded. It's recorded. So whatever you miss, you can go back and look.
And you can go back and watch. Now, here's the situation. I read about healthcare. I wrote about healthcare. I went into the healthcare system myself, but I was never educated to become a healthcare provider until the last 18 months that I've been in nursing school. I graduate next Monday, so hey, please attend. I'll send you the link. But what happened was, when I entered nursing school, it just blew my mind. I had no idea that nurses were being educated this way. And this is not to downplay or to degrade or in any way
disparage
to disparage my nursing school, because I shy away from assigning blame on an individual level, and I like to look at systems. Mm-hmm. Because the system will tell you more. It will get you to the answer. Mm-hmm. The focusing on an individual institution or person will get you only to blame. So you don't want to go there. That's not what
There we go.
So this is in no way meant to embarrass or to disparage an institution or anything. And when I spoke with the faculty members, and this is why, and I know my own faculty and teachers and instructors know this, because this is the same thing that I expressed to them. I entered school in January, and within the first day, I saw it and I said, this can't be what I'm seeing. No, I'm going to be in denial. I'm just going to live my best life, my best nursing school life. Sherma, you're not going to get into seeing everything through the lens of racism, because my head, this is how it works. Don't ask me why. So I tried to ignore it. But here's what happened. The textbooks, and once again, the textbook wasn't necessarily written by the institution that I attend. Mm-hmm. The textbooks use careless language. And I will tell you, ladies, you want to ask about a policy, you want to ask about changes, there's a policy. Banning the use of race-based education in this country.
Race-based. Wow.
Because the textbooks, which is the authority, you're even taught that the textbook is an authority. You're taught that.
Right. Right.
If the textbook is an authority and the textbook says that race is a predictor of health status,
yes,
then the textbook must be right. There must be something wrong with me. I must be inferior to all the people who are healthy, who do not have hypertension, who do not have diabetes, who do not have low glomerular filtration rates. There must be something wrong with me. That's the message that's given when the textbooks state variables that are linked to health status and outcomes and put race in the mix. Race is a social construct. It was made up. Social construct, i.e. made up. It was completely made up.
Right.
Wow.
So Sharma, just connect that with what you said before. So imagine a system that says, in the first place, there's something intrinsically wrong with you because of who you are. And then add to that a system that says social determinants and personal choice are the other half of what makes you
sick.
So there's no way.
So there's no way out.
Born that way, and you're making the wrong choice.
And you're making it worse.
You're doomed.
You're done.
You're doomed. And then that tells the healthcare provider there's nothing you can do.
There's nothing.
They're born that way.
Yep.
And they're making the wrong choices.
Exactly. And so you're in a situation where you hear this language being used very carelessly.
Right.
And at first we were okay as brown and black people. We were okay with the language because we didn't realize where it was going. We were thankful that the light was being shone on health disparities because we wanted something done about it, right?
Right.
So when we said blacks and brown had higher rates of this and higher rates of that, as far as we knew, the intention was to fix it, right? So we will highlight it so we can fix it. But what it also did was exactly what Tricia said, which was that it reinforces the idea that you are of an inferior race.
Yep.
That there is something intrinsically wrong with you that you could never get away from. Okay? So that's one of the first things I noticed. Then the other part of that was anytime we talk about a stigmatized disease, the image went straight to a black person or a brown person. Now, let me ask you this. HIV, AIDS. What image comes in your mind? We have been conditioned that way. Because in the media, the billboards, everything, it's people who look like us that are associated with these stigmatized diseases.
Right.
Then you start to think, well, there's something really wrong with me. And the people who came in already believing that there was something wrong with you, it reinforces their biases against their racist thinking against people, brown and black people.
Right.
So then take that and push them through an entire program where it's taught in every lecture, in every class, everybody they respect, and who will write them a recommendation and will teach them how to provide healthcare services, says the same thing. The authority, the textbook says the same thing. The scientific articles say the same thing. The language is careless. What happens? You go into a healthcare setting, you see somebody come in who suffers with chronic pain, and that person says, I need X, Y, and Z drug to deal with the pain. Oh, they're drug seeking.
Right. Right.
This person has end-stage renal disease. Oh, well, that's what happens to black and brown people.
Right.
It's just how it is.
Sharma, Dr. Sharma, can I just interject here and I have the comment here by Rosa Lorena. She's actually a nurse in Costa Rica. The greatest evil to me of this is that it's not only something that happens in America, because as you said, the textbook, all these countries translate and utilize these texts.
True.
So this poison is being spread. We're basically indoctrinating the world on a racist platform. Look at how deep this is. We are indoctrinating the world with this racist platform and philosophy and whatnot.
Yes, absolutely. And you know what? I'm so glad you mentioned that, Norca, because think about it. The world tries to emulate the United States. I don't know about now, because nobody wants to be us anymore. But in general,
No, not anymore.
before COVID-19, you know, you either wanted to be here or you wanted to look and eat and act like you were here. Okay. And so you saw populations that were healthier, eating the food that grew out of the ground that was already organic. Sorry, I have to throw that in. Eating like we eat. Giving up on the natural foods and going into a supermarket, you know, not growing anything and pushing a cart in a supermarket is where it's at. Giving up on walking and driving instead, stuff like that. So the world does emulate us quite a bit. And you're right, it's like a disease that then grows and infects. And the thing, it's so pervasive. It is so pervasive, it's invisible. It's invisible until somebody points it out to you.
Exactly.
And I remember telling, and the unique thing about my school is that when I did point it out, I researched it, I wrote on it, and I brought it to their attention. I gave them specific examples. I said, this is what I think should happen. They acted on it.
Wow.
They acted on it. As a matter of fact, the school is now undergoing an entire review, curriculum, teaching, communication, everything. There are about 8 working groups that are overhauling the entire system. Not because, and I will say this, and that is because I did not intend to blame and to shame, but to identify the issues with the system that needs to be fixed.
Exactly.
And so by taking that approach, one, you get buy-in, there's less defensiveness, and then a process can be laid out to then overhaul the system. And so consultants are being brought in, the whole thing is being redone. I had professors come to me and say, thank you, thank you, thank you. I didn't see it until you said it. Now I can't stop seeing it. It is everywhere.
Wow. Sharma, will you please share what the students, the Black students that were with you in class, said to you when you stood up?
Yes. When I first spoke about this, as a matter of fact, I was going to, everywhere I go, I get in trouble because I talk too much.
Good trouble. Good trouble.
Said,
Good trouble.
Good trouble.
Good.
I was like, I'm just gonna get my little degree. I'm gonna be on my way. You know, I'm old with wrinkles. I don't have time for nonsense. And I was going to do that. And I remember it was the last day of Black History Month last year. And a set of about 5 of our students approached me and said, hey, did you notice that everything bad is associated with being Black?
Wow.
It was heartbreaking. And I originally intended to just overlook it. And Tricia knows the whole story because she was right there with me. I was talking with her, consulting with her. What do I do? Because once again, you get emotional because it affects you.
Of course.
But you still have to be clear-minded enough to discuss it, to talk about it, right? In an appropriate and a professional way. And so it's on behalf of these students and myself and every person of color who will go through the healthcare system that I spoke up because it needed to be done. And so I also recommended to the school that they engage in some restitution through their alumni network, that they reach out and re-educate all the nurses they allow to pass through their system with false information.
Wow.
I think that's critical. I think we need to stop just being like, okay, moving forward, what about all the people you have access to? What about all these people you've miseducated? Now that you know better, you need to fix that. And you have the means to fix it. Social media platforms, email, newsletters, do it, fix it, it's doable. And they will do that. And so I stood up for these students. I stood up for us, brown and Black people everywhere who needed a forerunner in healthcare in the country and in the world to do the right thing. And so you know, sometimes you think about, well, why did I go there to school? Why didn't I go something else? And then something like this happens and you're like, that's why.
That's why.
Yeah.
Because that's what you were supposed to do. That's where you were meant to be at this moment in Earth's history. And so I'm just happy to have been able to be part of that. And I am confident that they will continue in the process on the track that they're on to making the systemic changes that need to be made. And that they will be an example for the other schools out there, not just nursing schools. We're talking about medical schools. And this topic has been talked about so much. There's so many papers on that. People have talked about it so much and said, we're tired of this. We want this to end. And if there's one thing I can say, you wanna reduce the incidence of the experiences of brown and black people, in the negative experiences of brown and black people in healthcare, we need to educate better. We need to go back. We need to fix the issues. We need to fix the bad education we've given people. We need to now press forward in an intentional way to do no harm.
That's right.
Dr.
I
Sherman,
love it.
may I ask this? Yes, definitely, do no harm. But Dr. Sherman, just hearing you say all that, it just gives me another thought. I don't know if it can be tied in somehow, but is this why Big Pharma makes so much money in our communities?
Hey, you trying to make sure I never get a job shot? Who's gonna hire me if I'm honest?
Well, there's a couple ways to look at that, and I know Sherma's gonna touch on this, but maybe before, because I thought about it before it skips my mind.
Yes.
Medicine, the teaching, the education of medicine has been founded on a standardized person. White male, 70 kilos.
That's right.
Oh,
Everything that has to do with dosage of medicines, and it has to do with BMIs, how you're measured in regards to weight, and all of that has to do with the model, which is white male, 70 kilos. And because of how we have been harmed and not our distrust of the system, but their unworthiness of our trust
wow.
in research, then there isn't enough out there to say what fits us. And there are so many examples of, for example, medications that work very well for other races do not work well in Black people for the same disease. But the way we learn it, because it's based on the white male 70 kilos,
Right.
is the first drug of choice, not thinking about who your patient is. So I've seen comments about the medications, about the textbooks, until we get to a place where there's enough research done with us, so that the examples, the curves, everything is written with us in mind.
Yes.
Then we're going to always need a translator.
Yes.
That translator is going to have to be a medical nursing professional who understands how it's written and can translate it for our lives.
Right.
So it means that we need our daughters, listen to me, please, going into science and medicine so that they can make a difference, and not just shy them away from it because it's hard or because they won't get married if they're too smart. And let them get into these fields because it's the only way. No one else was going to do this if it wasn't Sherma.
Right.
That's right.
Agreed. Agreed. There's a comment here that I want us to look into, and I know it's covering half of the screen, but I want us to read it. This person is saying that last year she was on vacation with a group of women and was shocked to see that almost all of them were on blood pressure medication. Especially surprised that the youngest woman of the group and her husband were also on the medication. One, she told me, was shocking. She went to the emergency room and the doctor said to the nurse from a distance, give her that name of that medication. Her people always have this and this, the disease.
Mercy. No.
Wow.
Norca.
But you can't be surprised.
We're not surprised, but now we're looking at the devastation of.
You know what's surprising is that they would take the medication without questioning
No,
the
but
medical
again,
professional.
you
You know
can't
what?
be
That's the thing
surprised.
with
Again,
you know.
but that's
I just want to say this.
yes,
You
yes.
know, I respect the medical professionals that are on this panel, but you know what? We have been taught to look at anybody in the medical field as smarter than we are, as you know. But you know what? Nobody knows your body more than you do, and you should never, ever, ever let a doctor or a nurse tell you what is best for you. You need to do your research. Today, there's no reason why you cannot do your research. You need to do it. And you know, it's a shame that you know, like they gave my husband high blood pressure pills also, just you know, a few years ago. And I'm like, you know, if you love yourself, you're not going to take this stuff. You know, you're going to do something else for yourself. And you know, this is worse off. I have a friend who's on high blood pressure, you know, medication, and I mean his health is going down the drain. And it's shameful, but we need to not believe that. We need to not put the medical profession on a pedestal. It's there for, you know, for a good purpose. I am not bashing them, but the fact is that we have given them the control of our health, and that is a big problem.
But I need to say something. I need to say something here, because I would not be I wouldn't be right if I didn't mention this. It is absolutely true that nobody knows your body better than you. That's absolutely true. It is absolutely true that you need to question whatever someone is saying, no matter what their degree or their title. It is also absolutely true that you need to do your research.
Right.
And that you need to find a medical professional you can trust.
Exactly.
Have a second, third, or fourth opinion. And this is the reason why I'm saying this. Just like there are many who have died because of listening, there are many who have died because of not listening. Okay? I'm not going to believe anything anybody says. I'm just going to drink my Sorosity, and that should be good. So they are drinking their Sorosity and downing their medication with Coke. You see what I'm saying?
Yeah.
So it can't only be mistrust. We cannot go so far to the end of mistrusting that we are doing danger to ourselves by not being reasonable and doing the research, asking the questions. But don't go in there and just take everything in, but don't also go in there and just don't accept anything. That is where we need the education and where we need ourselves in the field. We need ourselves.
I agree.
Yes.
Tricia, though, may I say something though? Theresa, I'm sorry.
Let me just say this. Just our communities have been indoctrinated to think that they are not capable of deciding for themselves. That's where I'm coming from.
I agree.
Look, if I break my leg, I'm the first one who wants to get taken care of by a professional. You know, I'm not that. So I don't blindly go either or. I think there's a balance. But what I'm advocating is that as communities of color, we need to totally erase this notion that, you know, we do not have the ability to make good choices for ourselves. That we have to depend on other people to make those choices. You know, look, you know, well, okay, I could go on, but Shaunda, thank you for letting me, you know, finish my rant. But yeah, that's where I say it with respect. You know, I mean, I have people that I love dearly who are in the medical field and who I know really genuinely care for their, you know, their patients. However, I also know that you are in a system that doesn't allow you to make decisions that are really in the best interest of your patient, because you have to stay within, you know, the norms that you are expected to function in. And I mean, that's the reality, you know. So I just think that as the only safeguard is for me as a patient to understand that I have access to information. I can do research. I can find, you know, a balance, you know, not only just blindly go with what I'm being told. But I know Dr. Saida Bar, who's on here, she's been commenting. She has another story, and I don't know if she wants to say it, but she's got more stories, and I hope that she can.
I think.
Anyway,
let's just have Shaunda. Shaunda wanted to give her point.
Shaunda.
I just wanted to share that Dr. Sherman started it off. I mean, she made it clear, and I think that. I mean, we're talking about the medication and how the piece is, if you don't know, and I think, Tricia, you may have referenced to this at some point, if you have no one or there's no supports that are in your environment, right? Or your communities, even your very home, your families, you have no clue where to begin and how to start to advocate for yourself. And so, yes, when you do go into medical, to seek medical attention, you trust that this person is a professional in it and that they're not going to guide you wrong. So sometimes we don't have those answers. And then the truth is, because of those same conditions that we go to trust them, those are the conditions, I think Dr. Sherman said, are why we have what we have. That's why we have these diseases. And so it's a yes and a no towards it. And I think this is where we just a conversation like this, it starts in our home. It starts with kids as little as 5 who can comprehend when they go to see the school nurse, why are you putting this Band-Aid on me? I mean, seriously, because if we don't, we'll continue to accept that indoctrination that we're less than, we're not worthy of it. This is what we need because genetically, this is who we are. A lot of it is also in our minds, you know?
Yes. So we're going to go into questions and answers, and we're going to ask those of you who are listening. I saw a couple of questions. Just put a Q in front if you have a question for Dr. Sherma. But I wanted to make a point that I think is interesting. We have been indoctrinated, and that the issue of internalized racism, right? We have been indoctrinated, and it's not just in the secular world. We have been indoctrinated in our communities of faith. We've been indoctrinated in education. We are an indoctrinated, traumatized group of people walking around the world, right? and we have to accept that and start to dismantle that, because unless we dismantle that, we are forever going to be. So don't come to me telling me that, you know, it's all kosher on the medical side, because we know it's not. And as Tricia said, you need to know yourself. And at the same time, we also need to step up to the plate now that we know that this is the case, and really start to dig deeper. But there is something that always bothers me about the medical profession. This one size fits all. Why are all these people taking the same medication? That's a problem for me.
Well,
so these are things that we need to question. We need to question these things.
Well, remember, so a lot of it has to do with how it's done. And you mentioned pharma. So physicians who see a certain type of patients have a menu of medications that they have on blast, so to speak. And those are pushed by pharma. And there's been more and more influence in not allowing that to happen, because the way it used to happen was pharma paid the vacation for the doctor and the family to learn about the brand new drug in Hawaii. Those professional developments never happened in Iowa. They always happened in Hawaii, in Fiji, in Las Vegas. Okay, so that has become less prominent, but it still happens. And that is why we keep saying, and we're going to say it, and we're going to keep repeating it. It's so important that we read for ourselves. It's true that people who do not have the tools of medical profession or family who knows may not be as prepared. Listen, it takes no preparation for the old lady to look in my face and say, and where you learned that? Happens all the time. And where you learn that? For some reason, they see a white coat and all of that bravery disappears.
Yes, true.
Okay, so that is where we're all in agreement that at the end of the day, systemic racism exists across the board. We need to attack it systematically for it to disappear. But for you to get ahead.
And to live.
For you to live, you need to.
Right.
You have to, because just fighting the system without educating yourself, educating your children, educating your sisters, stepping up, it's not going to happen in your lifetime, and it may not be happening in time for it to save you.
Right.
Yeah.
Exactly.
And this is the reason why we're doing
Yes.
the show. This is precisely the reason, because we're educating ourselves. So we're going to go to questions. Kayla's going to read. Please put a cue.
Norca, do you mind if I just say one thing?
Sure, go right ahead. Right ahead, Dr. Sherman.
I just listened to this conversation, and it's a constructive and a very healthy conversation. But you know what it reminded me of? That healthcare in this country is complicated.
Yes.
Very.
And it's complicated on purpose.
Yes.
It is no accident that it is this complex. There is no other industry where you buy a product that you don't know if you can afford, except healthcare.
Mercy.
Get the treatment and then later see
You get the bill
you
later.
afforded that treatment that you just get.
Yes.
Wow.
You have no way of knowing how much something will cost before you actually get it. And part of that is understandable, because there might be unforeseen things that may come up, complications, etc. However, you cannot pinpoint a cost. I tried one time, and I've read about this in the literature so much, but I like to put the literature to the test sometimes. So I was gonna see the doctor, and I called the doctor's office and I asked, how much is this visit gonna cost me? Nobody could tell me how much the visit would cost me. Have you ever gone to Nordstrom and picked up something, walk out the door with it, and don't know how much it costs, and don't know if your bank account can support that?
Never.
Of course not.
No one can tell me. They said, call your insurance. I said, okay. I called my insurance. Not even my insurer could tell me how much my visit is going to cost. They gave me such a large range that I could either afford it or maybe not be able to afford it. It did nothing to help. And the reason why I'm saying that is because healthcare is intentionally complicated and obscure.
I agree.
And what you're talking about, Theresa, is key, because this is why people feel helpless and unable to advocate for themselves, because they don't understand it. And the less you understand, the
harder it is.
The harder it is to advocate for yourself.
Absolutely.
So healthcare is for profit in this country. As long as something is for profit and it's a basic need, right? And it's for profit, you understand the complexity involved. You're going to get it, whether you can afford it or not, whether you have to mortgage your house or not, whether you have to put it on a credit card or not. And so as of 2019, the US healthcare spending grew by 4.6%, reaching $3.6 trillion, about $11,000 per person in the United States per year. It accounts for 18% of our GDP.
Mercy.
So let me tell you, fixing the healthcare system is actually not profitable.
Exactly.
Of course not.
It's not profitable. It's better for it to remain broken, fragmented.
Exactly.
And like I said, remember, when you look, let's think of this. If you look at a movie right now, none of what you see existed before somebody created every single detail.
Right.
It wasn't on the earth. God did not speak it and it came to be.
Right.
Someone created it, and it was created with intention.
Yes.
And you have to always ask yourself, what is the reason why things are the way they are? And I would argue that it is not necessarily in favor of the consumer.
No,
of course not.
Even when you look at protocols, insulin protocols, for instance, how people are medicated. And like, I want to be very careful here. I am not saying not to take your medication. I am not saying that. Okay, I cannot tell you to bypass your insulin.
Say it clearly, Sherma, please.
Drink a bush tea. I'm not telling you that. I'm not giving you health advice.
Right.
But I am saying that there are a lot of people out there, not type 1 diabetes. I'm talking about type 2 diabetes as largely lifestyle dependent, obesity being the highest risk factor for that.
Right.
I'm talking about something like type 2 diabetes, diabetes mellitus, where the carbohydrates are the problem. but eat the carbohydrates, then we'll correct for that, as opposed to control. So dietary control, exercise, lifestyle changes. And so you know, when you look at how hospital protocols work, everybody, you have to get a Dexy on everybody, a finger stick on everybody, determine their blood sugar level. And I understand that's for risk management, and you're trying to make sure people's blood sugars don't skyrocket when they're under stress. That tends to happen. But just think about how these protocols work. And sometimes, you know, you have to ask some questions about why things are the way they are. Sometimes they're beneficial. Sometimes they raise more questions than they provide answers. And once again, I want to repeat, I am not representing an organization when I say this. I am not speaking on behalf of anybody, and I am not advocating for you to bypass your medications. I want to be clear about that. But I'm just saying, I am just saying that the system is complicated, but it's complicated for a reason.
Right.
Yes.
And the key is educating each other, creating platforms where we can educate people in the simplest way so they can feel empowered to make wise healthcare decisions.
Absolutely. Absolutely. Yes. We're going to go to question and answers. We take a breather, and Kayla is going to lead us in question and answers. And Dr. Sharma, there are a couple of questions there that we can take the time. Kayla,
yes,
you have the questions. You control the questions already?
Yes, right now we only have one question so far.
Okay. Could you?
Okay. And just a reminder for those who are watching, if you do have a question, just be sure to put the letter Q before it so that we know that it's your question. Okay, so this question, it says, what are some basic questions that a patient needs to be ready to ask doctors and medical professionals when they are being prescribed new medications or when a new condition is diagnosed?
Okay, so a very good question. And we actually have a provider here, MD, somebody who prescribes medication. I don't as a nurse. But here's some things. And when nurses are trained, we're trained to do patient education as well. Okay, so, but you need to know for your medications, one, you need to know why you're taking the medication. You need to ask that question. What specific illness that you're taking the medication to manage? You need to be clear about the dosage of your medication, the medication schedule, the adverse effects, and the interaction effects. So when I say adverse effects, I mean side effects. We're more familiar with that terminology. What to look out for when you take the medication, what could happen, some of the common, some of the more complicated, and the ones you need to seek immediate medical help for. But you also need to know what foods you can eat with that medication, you can use with that medication, and what drugs you can and cannot use with that medication. Some medications you cannot take, you cannot use alcohol with them. Some, you know, you have to be on special diets to take them. Some of them, some complementary alternative non-prescription medications, like some people do ginkgo biloba, or some medications interact with like grapefruit juice or grapefruits and various other foods. You need to be knowledgeable. You need to have information, preferably written information that you can take home with you, that you can refer to. You need to have a number you can call if you're in trouble or you need to ask further questions. And hopefully you can then track that medication and create a schedule that you stick to and so on. So I think these are some of the basic. There are always more questions that you can ask, but I think these are some of the basic questions that you need to ask. These are some of the things you need to have answers to when you're given a new medication. Did I miss anything? You want to add anything? Okay, go ahead.
Okay, so I did have a question. And so I saw this thing going across the internet that said that as Black women, when we go to the doctor, and if they deny us a medication or prescription that we know that we want to take or that our body reacts well to, if they deny us that we are to ask them to put it in writing that they denied it. And there was this one lady who said that when she asked the doctor, can you please put it in writing that you are denying me? When he came back into the office, he said, you know what, you're right. You know your body better than me. I'm going to give it to you.
Yes, I actually saw that snapshot of somebody's Twitter post going around that they were instructed to do something like that. And I think the intention there was to advocate for yourself. That was the intention. If you are somebody, for example, who has chronic pain, that is a really common occurrence in the hospital setting, in the healthcare setting. If you have chronic pain, usually persons with chronic pain know what medications work for them. And so if you're interacting with a healthcare professional and you say, this drug works well for me, I'd like to have this drug, and you're denied that drug, then asking them to document that you were not given that you requested and were denied that drug is a way of advocating for yourself. Okay. And so I think that's the intention of that, is to advocate for yourself. And that's one way you can do it. That's one example of it. But in general, understanding your diagnosis, understanding your treatment, asking questions, not being afraid to ask questions. And what I do personally is that I write a list of questions on my phone before I go to the doctor. There is something called the white coat syndrome, where you forget all your questions, you have no more pain, your blood pressure returns to normal when you see the white coat that the doctor is wearing. Have you ever gone to the doctor and you're like, wait a minute, what was hurting again? You start to forget. I don't know what it is. You just feel better by taking the action of seeking care. It's more psychological. So it's better to write things down ahead of time when you're in your own space, when you're in your comfort zone, and as they come to you. So when you go, you don't have to depend on your memory. And you don't get distracted, because remember, when you interact with the healthcare professional, they're following their own protocols, they're following their process. Their process may not line up with the way you think, and it's easy for your own thoughts to get interrupted and for you to forget to ask a specific question. So I think that's a very good approach. Writing things down ahead of time, doing a little bit of research ahead of time on your phone. When I say research, I don't mean anything complicated. Google, some reputable sources. People like to look at WebMD and some other Health Today and some other sites, but where you can get simple information to just get a broad understanding of what you might be going in for, so that you can now have some questions and some language that you can use to advocate for yourself.
Thank you.
You're welcome.
And Norca, there are no other questions in the chat at this time.
Go towards our final points. And Dr. Sharma, you've actually hit all of these points already, but as a reason of maybe summarizing or making sure that everyone has an opportunity to hear it, let's start with the first point here, which is profiles at the door, right? Which is something that oftentimes we do not realize, that the minute we walk into any health institution, we are profiled.
You want me to answer, Norca?
Anybody can answer.
Okay.
Anyone can jump in. People can share their experiences. I
can say something, but Tricia, go ahead. I see you look like you're gonna speak.
That's how you study. That's how you learn medicine.
Mm-hmm.
You everything is defined by what groups of people are more likely to manifest one disease or another.
Wow.
And because you have a limited amount of time, and because you have to think in a methodical way and not just, spend 3 hours trying to figure out what it could be. Something that Sharma mentioned before, which is there's a process, there's an order in which you ask questions, and there's an order in which you examine. Then as soon as somebody starts walking through the door, you start knocking things off. That's called a differential diagnosis. So if you see a 40-year-old woman walking in, you're thinking already differently than if you're seeing a teenager, if you're seeing a male, if you're seeing an older woman. Mm-hmm. If she has abdominal pain, then you start thinking one way versus another. The problem isn't in that. The problem is when what you're thinking limits you from allowing any other option to be possible.
There you go.
If you see the person and say it has to be this, and no one is taking you out of that idea, mm-hmm. because you believe that because this person is that, it has to be this, that's where the problem lies. It happened to me. I worked at an institution. I was in leadership there. I had abdominal pain. It wasn't getting better. My brother, who's also a physician, took me. They saw me, Black woman, 42 years old, and decided that my abdominal pain was because of pelvic inflammatory disease, a sexually transmitted disease.
Wow.
And no matter how much I said this is not the issue, they would not believe me. And every question was around number of sexual partners, any kind of discharge, and they would not leave that no matter what I said, because since I was a Black woman of a certain age with abdominal pain, this is the only thing it could be. And that is where that creates a problem.
So let me ask this question, because I've also experienced that even with my husband. That automatically he walked in, they couldn't figure out what it was. He had high blood pressure, and the guy comes like, you could tell me if you had some cocaine. I'm like, what? You're talking to a minister? And then he was like, oh, I'm so embarrassed. What can we do to kind of jump over that hump?
Talk.
Because to me, it's off-putting. Like,
it's off-putting, but you have
already that I don't. What can we do?
Talk. You have to. So the things that our moms taught us that we wish we didn't have to do, that I'm not saying that you and your husband didn't do, but this is what we can do. Just like I told my son, if he's going to drive the car, wear a shirt, careful the music you're bouncing into. If they stop you, this is the way you need to address. And even that doesn't protect him. But at least there's steps.
So you're saying like there's a protocol of things that we all should perhaps educate ourselves on when we're going to see the doctor.
From how you present yourself.
Yes.
From how you present yourself. From the first sentence you say. Where you introduce yourself and say, hi, Dr. Smith. I am Dr. Richards, and I'm a minister at such and such a place, and then go into what you're feeling. Okay. You're setting the stage already just by speaking, and it shouldn't be necessary. So please don't feel like I'm saying this is what we all should do and that it's fair or right. We're in the part of the conversation where we're saying what I'm answering your question.
Right.
What can we do? So that's what we can do. Is it fair? Absolutely not. I wish it wasn't necessary. But to set the stage. Go in and say who you are from the get-go. If you don't have a title and you're not a pastor, just by how
and you're not a doctor,
and you're not,
none of that.
You can still, just by the way you present yourself and ask the question, set a certain tone. Some of us don't like to talk, especially Black men. Don't want to talk. They're going there forced by their wives because they don't feel like they need to go see any doctor. And it's basically like either you go or I'm leaving. Okay, I'll go. So even from the beginning of the conversation where you say who you are, that establishes a kind of rapport that then lets you skip over that, which is the question you asked.
So Tricia, I'm having issues with this. Here's
I
what
know.
I'm having issues.
I can see it.
Because when you sit there, they give you 20 million papers that you have to fill out, and in the paper you're telling them already.
No one.
They're not reading.
No,
you tell them, you go to them, you say, hey, I am experiencing this. My doctor sent me, blah, blah, blah. I just feel that the thing is so deep that even so let me ask this question. So if I'm establishing all of that, telling them who I am, blah, 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 and I'm not getting anywhere, the next thing I should do is walk out of there, right?
Say, is there another physician I can see?
Good.
Is there another healthcare provider I could talk
to? That I like.
Yeah.
That I like.
And so
Dr. Sherman, real quick, Tricia, and you said that Norco brought up a good point, but how about the doctors that don't even look you in your face or touch you? They don't even look up from the keyboard. They're just asking these generic questions, and you can't even get eye contact. That's the lack of respect you have in some instances. I've been with clients when I've walked in medical facilities, and the staff don't even acknowledge that. They don't even see them. So they don't even have a chance to say. And then in exam rooms, they're not touched. They'll pull your shirt up. Let me see. They don't touch. They don't look. I don't
That's not,
understand that.
yeah,
How do
that's
you?
not how they're taught. We could actually talk every day this week and not touch the surface of this.
Yeah.
I'll just say this briefly to try to explain. In order for you to practice medicine for any length of time, you need to develop certain mechanisms to be able to cope with dealing with other people's pain every day in and day out. That's just the reality of it. So you see some teachers that have taught for 30 years and don't seem like they like children, and you wonder what they're doing in education because they don't seem to like any child and everything bothers them. There's a certain level of distancing that you form around your heart when you're seeing pain every day. When that happens, if I go into anybody and they're not looking me in the face, I say, would you please look at me? I'm talking to you. And if they can't look at you, then you excuse yourself and ask for somebody else. You don't have to take it.
Right.
I'm just trying to explain the question that was asked. I'm not saying it's right.
Right.
I'm just trying to explain how it could happen and then say what you can do. You don't have to take it. You don't have to stay. That could mean that you have to wait however long. See, it doesn't go without risk.
Yeah.
Right.
But if enough of us are doing this, and if enough of us are saying, hey, Norca, I don't know who you go to, but this certain OBGYN, she was really good.
Right.
And we help each other by passing the word along and helping those who are good get the business.
That's right.
Then those are things we can do.
Absolutely. So let's go to the second one. And this, of course, hits close to home. We dedicated the program today to Shaisha in Washington, and we talked about the fact that it happened to Beyonce, it happened to Serena. These are women with money. These are women that I'm sure they went to the best hospitals. It happened to them. So that it happened to a Shaisha is not a surprise when it happened to these. What is the education? What is the mindset behind Black women in birth? Because there's clearly is a problem because there's a trend here.
This is where the system is messed up. And this is where I have issues with it. The reasons why Black and brown mothers are more prone to die are many, and they're not new. And we have developed a healthcare system that starts when the patient is sick and that begins at the door of the hospital.
No preemptive, right?
The system never changes to adapt itself to the community. The community is supposed to change to adapt itself to the system. So you're telling mothers, you must come earlier to prenatal care. If you feel this and this, you must come to the hospital. And if we know what the problems are and we have not addressed the system to reach the people where they are, and we're always expecting people to come to the system, this isn't ever going to be fixed. So what Serena did after this happened to her is say something I mentioned before, just before this. Let's rate it and then share the information with each other. This isn't just about official grading or rating system of hospitals. This is about the things that matter to you. So let's amongst ourselves say, this could be a hospital with the best rating, but they don't know how to treat Black women.
Yes.
They're creating a network where you can go find out that information and then have the ability, hopefully, to decide, hopefully, where you go to receive your care. And as Sherman said, this is so complex and complicated.
It's it's big, and I agree with everything Tricia said, both about with this response and the previous. One thing I want to want to tackle just in response to your question, Norka, is the fact that it's going to seem completely unrelated, but I'll connect the dots. In the media, we don't see Black women being portrayed as soft, in need of affection, in need of protection, in healthy relationships, caring for themselves. With the rise of social media, you see us portraying ourselves in these ways. But historically, for the most part of history, we have not been portrayed in that way. We have been portrayed as tough, as being with broad shoulders, being able to take on everything, being able to do anything. Whereas the narrative has been the complete opposite for white women. Fragile. We can identify with their pain, their tears,
white fragility.
They're part of good families. That's how they're portrayed. They're pretty. Everything soft and cuddly,
and deserving of care and attention,
deserving of protection, even at the risk of brutalizing and killing a young boy and throwing him in a river many years ago because he so-called whistled at a white woman. This is how we've been indoctrinated. We've been trained to identify with their pain and their fragility.
Right.
Our resilience has been weaponized and used against us.
Yes.
So let me connect that. When you go into the healthcare setting and you say you have pain or you don't look quite right, you're stronger, you don't need to be protected. You see how all these things come back in to haunt you? And these things a lot of them are unconscious.
Right.
However, the more we talk about this, we bring it into people's consciousness.
Yes.
And there is less reason to ascribe to being implicit.
Right.
When it happens. And this is where I'm going to go with this. I like to go to systems because this is where the big changes happen. We have had Black and brown women dying at higher rates. Pregnant women dying at higher. They've been sicker and they've been dying more. Higher morbidity and higher mortality rates. And the numbers are not getting better, right? And so how come, I think this is the question, how come at this point hospitals and healthcare settings, healthcare systems don't yet have healthcare bundles and specific protocols in place that allow us to be treated as a population, basically a protected population, essentially, an endangered species also, almost like how you would protect an animal that's on the verge of extinction.
Right.
How is it that doesn't yet exist so that particular attention is paid to our needs? So we can counteract the default, which is you're stronger, you're resilient, we pay you less attention, because that's what the default is. That's how we've been indoctrinated just by everything we've been consuming for so many years. And so for me, that's what I think about. I would like to see us protected in a certain way. And I know there might be some downsides to that. There might be some challenges to that. But I do wonder whether this is something that can be considered by health systems as they provide care. So when a mom walks in, there's the tendency to default to all of these stereotypes.
Right.
These protocols that have to be followed so that we reduce the risk that these kind of adverse events can occur. That's kind of what I think about all the time. If you have high-risk populations, how do you address these high-risk populations, and how do you reduce morbidity and mortality?
And as you said, the word here is protection. How do you protect these high-risk populations? I know that in preparing for this specific session, we came across the history of sterilization of women in this country.
Yes.
Right? Mexican women sterilized in Los Angeles area. Puerto Rican women went all the way to Puerto Rico, sterilized these women. Women in North Carolina, Black women, sterilized. So there is a history that is not on our side. The history really is to destroy us. We want to invite you to read up about it, find out about it.
Yeah.
You need to understand the root of why certain things occur. And this takes us to our third point, which is Blacks, the myth that Blacks have a high tolerance for pain, right? And you brought that up, Sharma. This idea that if you're Black, your skin is thicker, you can stand more pain. We have internalized it as Black people, right? Because we use, oh, I'm the strong Black woman, I'm the whatever strong. I don't allow people to call me strong because of that. But how do we deal with that I might be going through severe pain or going through some distress, but because of that training, because of that bias, because of that racism foundation, how do I address that as a patient walking in?
You know what I've been doing recently, and I would suggest we do it, is to say this. I know that there's the myth that Black women, Black people have a higher pain tolerance.
That's not me.
And I wanted to let you know that that is not true. This is not a fact. This is a myth. And I would like you to keep that in mind as we continue to provide care to me. I think sometimes you have to bring to the forefront what the issue is at the heart of it, so that now you've put that person in a situation where they have to now consider their moves. They have to now consider the way they care for you and the way they listen to you, because now you're not an ordinary person walking in at their mercy.
Right.
With knowledge. And even just a simple statement like that, I know there's the myth that we have a higher tolerance for pain, but I want to let you know that that is not true. That is not accurate. That is not scientific.
Right.
I can feel pain the same way you or anybody else can feel pain. Now, let me tell you how I'm feeling today. Okay. And we do have very good options when it comes to choosing and shopping around for healthcare providers, because we're restrained by our plan. What we have to cover, right? And so we don't always feel free to shop around. But I would encourage us to, like Tricia said earlier, ask who your friends are using. Are they good? Do you have somebody you go to that you trust? That's how I find my providers. I don't just look in the directory and pick one. I talk to somebody who looks like me, who has a similar experience like me, and I say, who do you go to? Do you trust them? What's your experience been like? And then I kind of feel that out and see who I can go to. I think that's key. But when you go in, lay the statistics at their feet. What if a pregnant woman who went in to deliver and said, now I know that Black women die at a higher rate than white women when they go in to give birth, and it's because of X, Y, and Z, 2 or 3 things. What do you think is gonna happen? People are gonna start being a bit more conscious, bring things that are in the subconscious to the conscious, so that there can be more care taken in providing services.
So our time is boiling down, and before we we always give this must-do, to-do list, giving people a takeaway, things that they can do and things that they need to consider. We want to take the time to affirm you, Dr. Sharma.
Yes.
You came on here, you brought your bomb, you threw the bomb out, you held, you were just on it real. We appreciate it. I think oftentimes as professionals, we feel that we have to tone ourselves down. We appreciate the fact that you were just, this is what it is. You came, you spoke the facts the way they are, and you educated. So on my part, I want to affirm you for that. And I'm going to ask my sisters to affirm you for them also individually.
I wrote down what you said because I'm going to teach it to my kids.
Yes.
Absolutely.
Great gratitude. Thank you so much for having me.
Thank you, Theresa.
Like to share? Yes.
My heart to your heart. I feel it all the way over here, sister. And I'm just going to hold on to it, embrace it for a little bit, ingest it, and then I'm going to share it with the rest of the women that I can come into contact with. So, Dr. Sharma, you are awesome.
Thank you
Truth
so
to
much.
power.
Yes.
Thank you.
You are a force to reckon with, and I think that there is a lot more still for you to do.
I just want to throw this in, Norca. I don't know if you know this, but
ahead.
this lady sitting in the corner there, Dr. Pennycook, Tricia,
Yes.
she has a lot to do with that. And
Good.
she's trained me well, just so you know.
All
My first
right.
job after I completed
Very
my
good.
doctorate.
Always important for us to have good mentors, right?
Yes.
Our next Dr. Fauci.
All right, next up. Yeah, we claiming that one. We're claiming that one. We're definitely that one. Talia is giving us thanks for dedicating the show to her fiance's cousin, Shaisha Washington. Listen, Talia, our hearts are with you guys. We send our condolences or prayers. This should not have happened. And we hope that with what we've learned today, this does not happen any longer in our communities.
Yeah.
That is our prayer. That is our goal. But again, thank you so much, Sharma. It has been fantastic. I know this is not going to be the last time you will be on here. So prepare yourselves. We want to end by just sharing with everyone our to-do list, and we usually have each one of the ladies walk us through the to-do list for today, and we're starting with Shaunda.
Yes, I think it was our theme. We heard it throughout. If you didn't, go back and watch it again and share it with others. But this is something that we do anyway, sisters. We just sit at a table like we used to do, or at a beauty salon, but now virtually. Be safe because COVID is still real. But sit down with trusted family members where you can talk about some of your health issues. We act like everything is a secret. Girl, we know we talk about each other like it's nothing. So why can't we sit down and talk about our health with each other, especially with trusted people, so that not only are we networking about our health, but we're networking about those doctors, those providers, etc. So come on, girls, let's just do this. Sit down and have a chat and focus on our health.
And ladies, listen to your bodies. And this is not only like a Zen moment thing that you should be doing, even though, we've recommended that you take the time to meditate. When you're in pain, that your body is already screaming bloody murder at you. That means you have not been paying attention to it. So pay attention to the discomfort, to just, anything, not only, your emotional health, but right now we're focusing on our physical health. You need to pay attention to your body and listen to it. When you do that, you will be taking precautions, to take care of things that won't take you into the emergency room, that won't take you into, a medical care that is unfortunately, having to be corrective. You can be preventive by listening to your body. Pay attention to what it's saying to you. So that's my take on for this particular to-do list. Listen to your body.
So my to-do is to speak up. Everything that's there in number 3 ends in speak up. You need to be willing to learn what you need to learn, do your research. As Sharma said, it doesn't have to be anything too deep, but read about what you are going to be seen for and ask questions and speak up about what you're feeling and stay there until you're satisfied that you understand what you need to understand to better take care of yourself. You don't leave your health into somebody else's hands. You need to own it as your own responsibility and do whatever is necessary to make sure that you are satisfied with the information you're getting, you're clear and understand the steps that you need to take, and that you are happy with who is providing that care. And if you're not happy, advocate for yourself, find somebody else.
And we want to say to you, finally, you have received today. We ask that you share. We ask that the replay you share on your post. We ask that you speak the information, teach the information that you've received on a repeat it again, because we've been conditioned to look at things differently. We have to recondition ourselves to look at things new, in a new and on a loop. Keep teaching, keep sharing, keep repeating. Find someone to pour all this information that you learned here today, pour that into that person. We are inextricably connected. Sometimes we feel that we're not, because, you know, I got a degree, I got a better job, I live in a different neighborhood. No, we are. Corona has come to show us that we are very much connected, and we're only as strong as the weakest among us. We're only as strong as the weakest among us. So it behooves us to work, to help, to teach, to share, even all those who are weak among us, and make it your duty to empower, to teach in your circle. We want to thank all our sisters. This has been fantastic. I want to specifically thank Kayla. Kayla came in. This is her first time moderating, and she did a fantastic job. Kayla,
thank you.
She was on cue. She did everything well. We want to thank you for jumping in, and we appreciate having you on the pink table. We want to thank all of you who took the time to be with us at the pink table. You could have chosen to do anything else, go anywhere else, but you chose to watch, and we want to honor you for that. Again, we want to thank Dr. Sharma for coming in. And now, as we say goodbye to you, let me just say this quick thing that I forgot to say at the beginning. This is not a weekly show, but it's kind of becoming a weekly show. Because y'all keep having issues that we have to talk about, people. There's always drama out there. We have to talk about it. So we all heard Alexandria Ocasio-Cortez powerful, speech on the floor of Congress, right? Either yesterday or 2 days ago, I can't remember. We need to have a conversation about that speech.
Yes.
And what led up to it.
And what led up to it. And everything that leads up to these things, right? Mm-hmm. So we're inviting you next Sunday at the same time, so that we can, last Sunday we had a conversation about the entanglement. This next Sunday we're going to have a conversation about the speech. So we invite you to come in.
Yes.
And we invite you to invite your friends as we bid you goodbye. See you next
Don't forget to walk, run.
And the walk race, right.
Sign up.
Check our Facebook page and sign up to walk with us. Have a good one, everyone.
And we'll see you next time in the Pink Room.
The Pink Room is a produced resource of For Real Women International, Inc., a non-profit organization with headquarters in New York and affiliates in the United States, Latin America, and the Caribbean. The views expressed here by hostesses and guests do not necessarily represent the philosophy of For Real Women International, its affiliates, members, and board of directors.